Welcome to Lesson 7, which focuses on communication and coordination during disasters. This specific session, Lecture 7, is dedicated to understanding how information flow and organizational structure save lives during crises. Communication is the backbone of any disaster response, acting as the vital link between medical professionals, emergency services, and the public. Throughout this lesson, we will examine why effective communication is important, how internal hospital systems function, the necessity of external coordination with outside agencies, and the command structures that keep operations organized. We will also address the common challenges faced during these high-stress events and the strategic solutions used to overcome them. Proper coordination ensures that resources are allocated correctly and that every team member knows their specific role when every second counts. Importance of effective communication is the first pillar of disaster management. Clear information sharing is essential because it ensures that accurate, real-time data is distributed rapidly to all stakeholders during an emergency, preventing the spread of dangerous rumors. Coordinated response is the second key element, as good communication allows various hospital teams, from triage to surgery, to work together with seamless efficiency rather than in isolation. Finally, reducing confusion is a critical goal. Providing clear, concise messages prevents the misunderstandings and operational delays that often plague emergency responses. By prioritizing these three areas, a healthcare facility can maintain a stable environment, even amidst the chaos of a large-scale disaster. Internal hospital communication focuses on the systems used within the building's walls. Clear information sharing within the internal setting means that doctors, nurses, and support staff receive the same updates simultaneously, ensuring a unified approach to patient care. Coordinated response internally means that departments like the pharmacy and radiology are synchronized with the emergency department to handle patient surges effectively. Reducing confusion is achieved through standardized protocols and terminology, which ensures that internal messages are interpreted correctly by all staff members, regardless of their department. This internal harmony is vital for maintaining the flow of patients and ensuring that critical medical equipment and supplies are directed to where they are most needed. External communication involves the hospital's interaction with the outside world. Coordination with emergency services is a primary requirement, as hospitals must maintain constant contact with ambulance services, fire departments, and police to manage incoming patient volume and site security. Public health authorities also play a role, as hospitals must share critical data with regional or national health agencies during large-scale incidents to track disease outbreaks or casualty numbers. Community communication is the third aspect, where hospitals provide official updates to the general public and victims' families through verified channels. This transparency helps manage public expectations and provides necessary instructions to the community regarding which facilities are available and where to seek help. Command and coordination structures provide the framework for external interactions. Coordination with emergency services is facilitated through these structures to ensure that the hospital's needs and the capabilities of first responders are perfectly aligned. Public health authorities rely on these formal structures to receive standardized reports, which allows for a broader regional or national picture of the disaster to emerge. Community communication is also managed through this structured approach, often involving a designated public information officer who ensures that the messages sent to the media and the public are consistent, accurate, and authorized. Without these formal structures, external communication would become fragmented, leading to a breakdown in the overall disaster response effort. Communication Challenges and Solutions addresses the practicalities of managing information under pressure. A central command system serves as a solution by creating a dedicated command center that manages all incoming data and centralizes the decision-making process. Clear reporting lines are established so that every staff member knows exactly how to report information up through the proper chain of command, preventing information bottlenecks. Coordinated leadership is the final component, where designated leaders guide the overall response and ensure that all teams are strictly following the established disaster management plan. These solutions work together to mitigate the risks of communication failure, ensuring that the hospital remains functional and effective throughout the duration of the emergency event.